I'm about to tell you one of the more haunting stories I've seen in 20 years of journalism. During the COVID-19 pandemic, I found myself in Helena, Montana, having drinks with staff members at St. Peter's Hospital. They told me a story about a patient who received 11 years of chemotherapy for a stage 4 lung cancer. That patient died. The autopsy comes back negative for cancer. After a 2-year investigation, I found that a small-town doctor, though revered and loved by many, was connected to a trail of patient harm and suspicious deaths. Dr. Weiner is St. Peter's sole oncologist from 1996 to 2020. As the only oncologist in the region, Dr. Weiner kind of built up this kingdom where no one really questioned him. It took a traveling doctor to question why was this guy being treated for 11 years of stage 4 lung cancer. And as he's asking these questions, Scott Warwick declines. His left lung collapses. He's flown to the University of Utah Hospital, and his wife is pulled aside by the doctors there who are trying to figure out what's wrong with him. And according to court records, this doctor tells Lisa, "Do you want an autopsy?" She says, "Yes, I want an autopsy." That autopsy comes back negative for cancer. Through the course of reporting, we identified 10 suspicious deaths. There are also 7 what we call the phenobarbital cases. Patients who were talking and seemed to not be at death's door were given large doses of this drug, which is a barbiturate, and they died shortly thereafter. In my investigation, I found that Dr. Weiner treated a child for a type of kidney cancer for many years, and when she was 16 years old, that cancer had recurred. She ends up in the ER. And eventually he orders the administration of a very large dose of phenobarbital, and that kills her as a result. I interviewed Dr. Weiner over many hours, and he described the way he makes money as, quote, "eat what you kill." And what he's really talking about is a pay structure that, the more treatments and patient visits he bills to insurance, the more money he makes. And we found through, various, data analysis and records that he was, quote, an exceedingly high outlier, that he billed for more 15-minute visits than any doctor of any specialty in the nation. And he was making about $2 million a year. In the time period in which Scott Warwick was treated, he made more than $20 million. He built a high-volume business, essentially billing as much as he possibly could to insurance, meanwhile sending numerous patients through a carousel of needless and sometimes life-threatening treatments. Dr. Weiner's unapologetic. He thinks he's done nothing wrong. He denies all of the allegations, and he has quite a few people in town who remain supportive. So Dr. Weiner was fired from the hospital. However, he maintains his medical license. The federal government has sued him for an array of alleged billing fraud charges. He denies those claims.